how friends and family can help after a scoliosis diagnosis. Scoliosis involves the development of an unnatural spinal curvature. The scoliosis is typically diagnosed through a physical examination, typically a postural examination, which requires a bending forward test and also a symmetrical test, and typical X-ray that reveals something called a Cobb angle, which determines the severity of the scoliosis. Now, we know scoliosis affects all ages, but it's most commonly associated and diagnosed in adolescent children. And the most prevalent type of scoliosis overall is adolescent idiopathic scoliosis that's typically diagnosed between 10 and 18. However, many cases of scoliosis go undiagnosed and are not diagnosed into the adult form because the curve never progressed large enough to be actually visually seen. The problem with scoliosis in children is that normally it doesn't cause lots of pain or discomfort. So a lot of adolescents don't take scoliosis very seriously because they can do and function very normally. And the hardest thing to hear about scoliosis is that despite it not causing limitations or pain when its curves are first starting, is that it's hard to hear that scoliosis is a progressive condition, especially in adolescence. And its very nature to worsen over time and worsen at the most critical times of growth and development. So normally we expect during pubescent growth spurts to unfortunately see progression, and the curve is definitely going to progress. As it gets bigger, it's more likely to progress. So it's a self-perpetuating cycle that as the curve gets bigger, it wants to get bigger faster. Also, it could be hard for them to understand that as the curve worsens, what they're experiencing is going to worsen with it. Posture, balance, cosmetic appearance, gait, and as curves get bigger, it can start affecting other systems and functions of the body. So it can be hard to hear it's uncurable and it's progressive, and it's going to more likely cause more things as it gets bigger. So when we look at adolescence, what are some things that we should understand? That number one is that education is by far the most important thing. The more an adolescent understands their problem, the more they understand the complications associated with the curve's progressing, the more they look at how invasive other options can be in treating scoliosis as it gets more severe, the more likely they are to respect it and understand that this is something to take seriously. So talk to adolescents about their condition. Ensure that they fully understand what's happening and how treatable scoliosis potentially could be if it's treated accordingly. We know there's many celebrities and warcraft athletes that have scoliosis, so also advise them that just because you have scoliosis, it doesn't have to be a life length of limitations. In fact, many patients with scoliosis use treating their scoliosis and overcoming the progressive nature of scoliosis as inspiration to accomplish great things in their life. So these things can be stories of motivation and inspiration to overcome, to create something better and stronger that they may have seen that was possible. There's a lot of misconceptions regarding the treatment of scoliosis. There's a lot of misinformation regarding the progressive nature of scoliosis. So the best thing anyone can ever do regarding scoliosis or a family member or an adolescent in their family with scoliosis is to fully understand the condition and to fully understand the progressive nature of it. Now, when we look at scoliosis, we definitely know there's some things that I don't recommend that you do. And even though there's many mistakes, these things are normally done with well-intention, and they're normally not done to try to be spiteful in any way. But before talking to an adolescent scoliosis, like I mentioned, make sure you're fully educated and you kind of understand the realities of scoliosis, not only as an adolescent, but as an adult, as an older adult, and even in later stage life. Because a lot of times making empty promises about things in the beginning could set up expectations of failure. Like promising things that are going to be fine when we really don't know. When we normally first diagnose scoliosis, what are all the complicating factors associating with it? Promising that your condition will never get worse. Don't worry about it. It's not going to get worse. These are not good things to promise because we know scoliosis is progressive, especially if it's not treated correctly. In adolescent idiopathic scoliosis, we don't know why it happened. Talking about theoretically why you think it happened to that child, or why maybe something they did, and maybe they make them feel almost guilty, like they were involved in the causation. We don't know this. We have no real reason to identify why an idiopathic scoliosis is developing. We don't know why in some cases it worsens and why in other cases it doesn't. All we know is that once it worsens, the best thing we can do is to treat it effectively. The best thing that families can do is really is how they respond. Making sure a patient is fully understands all the treatment options and really everything that's available to them and the potential outcomes of each treatment option, I think is the most important. So asking questions to your providers that you choose, asking questions to any potential orthopedic doctors or chiropractors or physical therapists, and really trying to be proactive in choosing the best treatment approach. Because honestly, if you treat scoliosis early when it's initially diagnosed, there's really never treatment guarantees. But with early treatment, when you find it, meaning early detection also combined with early intervention, we always know there's less limitations that can be achieved for their health and well-being. So finding out the diagnosis, exploring the options, intervening if you find it necessary at an early size can lead to greater chances of success, where scoliosis is going to lead to less issues. So we know all scoliosis patients need support, but we're mostly focusing here on adolescent cases because we know adolescent cases just really just want to fit in with their peers. And they don't want a condition that's going to affect the way they look or walking around or anything like that. So the best things families and friends can do is educate themselves, be supportive. And what ends up happening is that when patients accept the scoliosis and they treat it and they overcome it, they find that treating the scoliosis was empowering, and it almost changes them to become almost a motivating factor than an unmotivating one. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.